South African healthcare workers have penned an open letter condemning human rights violations in Gaza. They're calling on the HPCSA, CMSA and South African Medical Association for higher education to take a stand against what they say is the oppression faced by Palestinian people as the Israel-Hamas war rages. Dr. Aayesha Soni from the Gift of the Givers joins us now to talk about the open letter. Very good evening to you. Doctor, good to have your time. What you're talking about in this open letter is basically a boycott of Israeli institutions. What would that look like?
Thank you so much for having me. So I think this open letter is very significant. It's been penned by 1,280 healthcare professionals from across the country. This includes 38 professors, heads of departments, 875 doctors, including almost 220 specialists, and then a range of allied health professionals. And basically, it's the plea to our health regulatory bodies. We all have to be members of the HPCSA. Many of us are members of the CMSA, and many of us are in public institutions where, like the Faculty of Health Sciences, and it's a plea for them to come out publicly and actually denounce the targeting by the Israeli army of healthcare workers and healthcare facilities, because we find that this is abominable. We demand that this be stopped immediately, and we're also calling for an immediate ceasefire, so a permanent ceasefire, which would mean that Palestinian people would need a reinstating of their human rights.
And you say towards the end of the letter that it's time to heed the call for an academic boycott of Israeli institutions. How would that work?
So I think from our own history and from our experience as South Africans, we know that one way that we can put pressure on an oppressed country, to put pressure on an oppressor country and to show our support for oppressed people is through boycott, divestment and sanctions. That has had its role in the past. As healthcare workers, I think this would be specifically very important. We have academic institutions, we have our ties with them, and Israel has its universities in that same way, and we have these connections. And the only way to actually bring about the support and to bring about the pressure on the Israeli government to stop what they're doing is actually to put this pressure on. For example, last week there was a letter released by 100 Israeli doctors. It was signed by 100 Israeli doctors, and they were calling in an open letter for the complete annihilation of all hospitals in Gaza. So when you have the mentality of people who believe in Zionism, who are supporters of what the Israeli army is doing in Gaza and the occupied Palestinian territories, we cannot have any relations with these people, whether it be in academic space, whether it be in a medical professional space. And this is purely from a basic human rights and healthcare workers' perspective. So I think that's what appealed to so many of the healthcare workers, that when this letter went out and why so many of them signed it.
And Dr. Soni, when you say, just on the issue of the boycott, because I'm trying to be as clear as possible, are you suggesting as a group, for example, that South African medical students or South African doctors, for example, not do any work within the Israeli healthcare system and vice versa, that there not be any exchange perhaps of, I don't know, medical research, medical tools? I don't know what the nature of the relationship is currently, so I'm just trying to understand what a boycott would mean in everyday terms.
So the letter was penned by a group called the South African Health Workers for Palestine. This is a group that is actually being created out of the current situation that is happening since the 7th of October. And they're basically promoting a whole range of action to take against Israel and to try to stop what is going on in Gaza. So to answer your question directly in terms of what we would demand, it would be the cessation of academic ties with all Israeli universities. And even if that's extended to medical research, I think that that's a viable alternative given what's going on in Gaza at the moment. And that's something that the South African healthcare system can bear the brunt of.
And at the moment, I wonder if the issue or the war on Gaza currently and what Israel says is its mission to basically annihilate Hamas, is that playing out in hospital corridors? I wonder if it's divided hospital staff, medical professionals such as yourself, as much as it appears to have divided some societies.
I think the answer to this question has been debated a lot, and the answer for me came in an article that was actually published in the Journal of American Medical Association, so that's the JAMA journal. It's one of the highest rated academic journals in the medical field at the moment, and it was written by Dr. Matthew Weinier. He's part of the Center of Bioethics and Humanity at the University of Colorado, and basically what he said is he came to three conclusions. He said, as healthcare workers, we have three duties. We have to condemn dehumanization and genocide. We, as healthcare workers, have a special responsibility to speak out about certain war crimes. And this is relating, what's going on in Gaza. There's no debate whether it's a war crime. It contravenes the 19th Geneva Convention, various human rights laws. Anybody who knows anything knows that what Israel is doing is a war crime against healthcare workers. And the third thing that he said is that we need to speak out against all anti-Semitism and anti-Muslim hate. And then what he came to is that he said that when you look at it from a moral perspective, any healthcare worker with goodwill cannot debate whether what's going on is wrong. I mean, there are 34 hospitals in Gaza, 26 of them have been bombed and are non-operational. There have been 266 doctors who have been killed in the last 2 months that has been documented that we know of. The head of the largest hospital, Al-Shifa Hospital, has been arrested by the Israeli army. 4 pediatric hospitals have been targeted, including one with white phosphorus. So what we're seeing in Gaza really is the most robust attack against healthcare workers in the modern day era. And there really is no morality. There's nothing about Hamas to discuss. It's really just about basic human rights. And even when Israel has tried to claim that Hamas is operating from Shifa, there really was no evidence. Whereas the evidence when it comes to the human rights violations that are going on, there's no paucity of evidence. It's been confirmed by the WHO, Physicians for Human Rights, Doctors Without Borders, Amnesty International, Physicians for Human Rights. I mean, all organizations that have a reputable reputation are coming forth with evidence. The United Nations has lost more of its workers in its history. 133 United Nations workers have been killed by Israel in Gaza in the last 2 months. So while they can claim that Hamas is operating from Shifa Hospital and from all these other hospitals they bomb, we have yet to see any evidence of that. And really, as a healthcare worker, we're really just talking from the morality of it.
Dr. Aayesha Soni, good to speak to you. Thank you for your time.